Conscious, unconscious athlete evaluation, primary and secondary survey. History. Try to get a history from those around. Mechanism of the incident injury. Previous medical history. Current medications and or allergies. Observation. When the athlete while putting on gloves. Environmental factors, weather, field hazards, equipment. Body position. Patient on ground with arms raised above head may indicate spinal injury. Severe bleeding, gross deformities. Skin color. Athlete check for consciousness. If unconscious, send someone to activate EMS. Note the time. Primer assessment. Don't remove helmet. Check for obvious signs of life. Look, listen, and feel for breath for 10 seconds. Get AED. 1 respirator, 3 compression, 2 breath. Weight of 100 to 120 compression per minute. 2 respirator, ratio of 30 compression, 2 breath. Switch when AED analyzes with them. Alert 911. CPR, rescue, breathing in process. Life-threatening bleeding. Check for severe bleeding. Control with direct pressure and pressure points. Brachial and femoral arteries. Spinal injury precaution. Stabilize, mobilize neck, head. If this isn't present, have assistant stabilize neck and apply C-collar. Log roll and spine board the patient. Qualified assistant present. Coordinate with EMS. List signs and symptoms of shock. Pale skin color, cool clammy skin, weak and rapid pulse, shallow and rapid respirations. Pupils may be dilated when in shock. Blood pressure may be falling. Bright red heat stroke, pale blue hemorrhage. Taken vitals, level of consciousness, pulse, blood pressure, respirations rate and depth, skin temperature and appearance, pupils, pupils equal and reactive to light. Secondary assessment, history, where does it hurt? Do you have pain in your neck? What happened? Do you hear or feel anything? Can you numbness or tingling sensations? Can you wiggle, move your hands, wiggle fingers? Can you move your feet, wiggle toes? Orientation, check. Level of consciousness, ask who, when, where, what were you doing? Head to toe survey. Do quick check back for obvious severe injuries, bleeding, fractures, deformities, edema. Look for normal to see abnormal. Head, scalp, eyes, ears, nose, and mouth. Blood, CSF. Cervical spine. Check in nose, C-collar. Point tenderness, dislocations, abnormal alignment. Thoracic and lumbar spine. Point tenderness, dislocations, abnormal alignment. Trunk. Clavicle, shoulders, chest. Movement on both sides equal. Normal rise and fall. And compression test, crepitus, false or abnormal movement. Abdomen, check for quadrants and rigidity, tenderness, and rebound tenderness. RUQ, liver, gallbladder, colon, or kidney. LUQ, stomach, spleen, pancreas, colon, L kidney. RLQ, colon, intestines, appendix, McBurney's point, uterus, females, ovaries, fallopian tubes. LLQ, colon, intestines, uterus, females, ovaries, fallopian tubes. RLLQ, bladder, females, uterus. Pelvis compression tests. Fractures, outward rotation of hip and appears longer is the common sign. Dislocation, leg appears shorter and inwardly rotated with knee flexion. Legs and feet, check for fractures and bleeding. Check dorsal pedal or posterior tibial pulse bilaterally. Check motor response and plantar and dorsiflex feet bilaterally. If unconscious, scratch foot, Babinski's response. Great toe extended plus others splayed. Upper motor neuron lesion. Check sensation. If unconscious, scratch each arch of foot. Arms and hands. Check for fractures and bleeding. Check radial pulse bilaterally. Check motor response. Squeeze fingers bilaterally. Check sensation, and if unconscious, scratch each palm. Recheck vitals, level of consciousness, pulse, respirations, blood pressure, skin temperature, and appearance. Pupils, pearl. This concludes the primary and secondary survey. I now have a better understanding of the specific injury. I would maintain the airway and continue to perform rescue breathing and or CPR until relieved by qualified medical personnel. I have controlled bleeding, splint fractures, treat for shock, check vital signs every 5 minutes, and monitor level of consciousness constantly. I would then refer my patient to a physician as needed.